Just welcome you again. We're going to have 60 minutes together to explore this subject of how we do referrals from churches and faith-based organisations. And it's a pleasure to welcome Sue Hopkinson from Burnley Family Hubs. Sue, thank you very much for being with us today. We've got Chris Linus from Stockport from Social Prescribing. And we've got Julian Samson, who's been very involved as a vicar down in Birmingham, connecting with the health service and helping faith leaders refer there. And not last but least, Sir Peter Heywood, who works with Gather as a trustee and has got lots of experience running social action projects in Bath. So, Peter, if it's all right with you, I'm going to hand over to you first of all and ask you, well, before I do that, let me just show you a quick picture, because the thing about Gather Movement is that we're passionate about churches and faith groups working together. And here you'll see an example of that. This is an example of some mapping that we do around the country now. This one is from Oldham. And you can see we do a telephone survey and we ask the churches, what are they doing to support their community in terms of social action around different themes, things like food, supporting families and mental health and so on. And we create this map that shows us where all the churches are and what they're doing. And this is a really valuable tool that we're using in our discussions as we get around the table with civic and health authorities. So that's a bit of context. We're thinking about this idea of referrals when we're working not just as churches on our own, but as part of a network of churches, and thinking about actually how we can be more effective together. So that's a little bit introduction. Peter, let me hand over to you now. I'd love you to talk us through why referral routes are important in terms of what churches do.
Thank you, Mark. Thanks, everyone. Hi. I'm based in Bath, and we have here a church hubs network, which I just want to tell you about, because it comes into how important referrals are. We have got about 25 out of the 63 churches in Bath, city of Bath, that are all connected together in this network. And our aim is to have a church hub within 15 minutes walk of everyone in the city. And we're sort of more or less there already. This is a place where relationships obviously are built with local people. They find it sometimes hard to go into a council department, but pray they come more easily into where we are. Prayer is always a really important point, so that we're not just the social services from a church building, but it's a place of prayer for us and for all our guests. And wanting to encourage people, children and families and young people and older people and people who are in crisis, into different buildings at different times. I'm sure that that's quite a common theme among all of us in our different cities. We have a strong principle which we call good help, and you may have heard this already, and it says what it is. Good help is helping people not to remain dependent, but to become independent in whatever way is best for them. And that means giving them opportunities that they may not have together, and the determination and hope that they can move forwards. And that means that while we build relationships in our hubs, we can't provide all the answers to all those questions that they face. And therefore, we need to have good ways of helping them to find and get to and be part of other places where they can receive another bit of the good help that they're getting in order to move forwards. So one of our main aims is to build relationships and then to provide that sort of link into good help. And what that means is that we need to have a referrals system, which I'll talk about in a moment. And we then need to have what we call buddies. So to take someone from here to there in a friendly way so that they're able to get there. And those are the two areas that we are working on as part of our Church Hubs network, and very much in connection with the council and surgeries and other areas as well. So looking at our city overall, lots of stuff is happening to help people in individual places, from mums and toddlers groups to old people's groups to people help people in crisis and so on. It's the connections for us that we see that need to be developed. This is not about creating more places where stuff happens. It's about helping a bit more to happen where it does, where it is, and to build those connections and give confidence, and to all of us to feel that we're part of one project rather than isolated projects. So that's just a summary of where we're at the moment. Mark, I can explain a bit more about the referral system, or do you want us to come back to that later?
Yeah, let's come back to that a little bit later. Thanks, Peter. That's a great introduction of what we're aiming to do. And I guess I want us to think a little bit more about what the needs of our community are. And we've got obviously Susan here, who's an expert on families, children and families, and Chris, who's an expert on mental health. And I guess I'd like us to maybe focus on those two areas, thinking about what are the needs in our communities. And it's probably, I mean, as we reflect as church leaders, we will come across a great range of needs in the people that we mix with and meet. And Sue, it would be great just to sort of hand over to you at this point, and just for you to perhaps identify from the work that you do with children and families, what you see as some of the most common and significant needs in our communities.
Okay, thanks for that, Mark. So obviously I am part of the Children and Family Wellbeing Service, which is Lancashire County Council service, and I lead on the Family Hubs network. So I'm speaking about the Burnley picture, and we're in East Lancashire. But I think it's quite reflective of what we see across the county. I think it's fair to acknowledge that when we talk about the needs of children and young people and families, that it's not just an individual need. Sometimes it's multiple complex needs that we see, and that's what we're seeing considerably more and more in Burnley. There's a high level of deprivation within the district, and that does reflect the need. So if we talk about the needs that we see on a referral basis coming through, so it's housing needs. So that might be poor housing, the lack of housing that families can access, where there are private landlords maybe, and the maintenance of those houses. Finances, we're in a cost of living crisis, so that's hitting families considerably. Mental health and emotional well-being is significant across kind of the vast majority of all referrals that we receive into the service, and that's affecting the adults and the children and young people. Particularly from COVID, what we experienced is we'd seen incidents of young people who were having mental health challenges and incidents of self-harm. But from the COVID, kind of the COVID fallout, which is just 5 years ago, isn't it? We saw children who were self-harming, and that was, incredibly shocking. We have substance use issues. So across Burnley and Paddy areas, we have a huge issue with ketamine. It's not just linked to Burnley. I know it's an issue that's across the country. And that's something that we're trying to raise awareness across professionals, because it's such a horrible thing to be connected to. Youth antisocial behaviour, again, huge issue. Domestic abuse is something that we see on the vast majority of cases, but there's a lot of kind of underreporting of domestic abuse incidents. What we're seeing an increasing rise on is that child on parent abuse. So sometimes where the child has maybe been exposed to that as a younger child and then become perpetrators of that similar behaviour. We have the challenges with young people being exploited, sexual exploitation, criminal exploitation, that then links with missing from home reports. That's linked to youth antisocial behaviour, and then further links to grooming. So, but what we're seeing that is a younger age, 10 and 11-year-old children that are being exploited in those ways, and those are incredibly vulnerable individuals. We also work with a lot of families who are new to country, so coming from a whole host of countries, and there are some amazing organisations in Burnley with some incredibly dedicated people and linked to the church network, which is just phenomenal. And I think it's understanding the whole set of challenges that those families face when they come to the UK, the language barrier, the access to funding, there's lack of housing, the trauma that they come with, you know, from the journey that they've got from wherever they've come from to wherever they arrive. You know, so Burnley's actually going through a process to become a city of sanctuary. So I'm part of that. So that's really brand new and very exciting. So that's just a little bit of an insight, not painted a great picture, but I think that picture is reflective of kind of some of the hard hitting kind of referral reasons that we get for families. But again, just to reiterate that all of those ones that I've just kind of highlighted, we get the referrals that are multiple complex family needs. So there's just so many things to tackle. And that's where that multi-agency, that partnership approach is essential to best meet the needs of that family.
Yeah, great. Thank you, Sue. That is incredibly helpful. And we'll talk a little bit more in a moment about how you refer people on to the wider services. But actually, just take it back a step to the other side of you, which is that if I'm a church leader running a toddler group and I've got a parent that I think has got perhaps one of the challenges that you've just mentioned, what can a church leader do? Would they bring someone along to one of the family centres that the council runs, or how do we actually connect them to you?
I think yeah, that's a good question. I think Peter kind of alluded to that about what is happening in churches and what is happening within the family hubs and the family centres that we've got across. And I think it's about that connection. So it's different. For us in Burnley, we have something called a case consultation, which allows an opportunity for anybody who comes into contact with families in a supportive way. So that could be somebody through a church to say, we have a family, this is their situation, this is the support they need. And it's a very, very informal conversation to understand what's out there, because whilst I've just painted that picture of Burnley, there's an awful lot of need in Burnley as a district, but there's an incredible amount of opportunity with the wealth of partners. And I think sometimes the challenge that we face is how we connect that need to that opportunity. So how do churches know what's out there? So it's about getting that message out there, and that's what we do with the mapping exercise. We've been involved in that obviously in Burnley, haven't we? And it's great to understand what the churches can offer, because for us it's around we can signpost. It's about empowering families to access services in their local community. So if there's a parent and toddler that they can go along to that session, if there's a food bank within the church, it's about signposting, so raising awareness. There's obviously the formal referral pathways, but quite often what we're looking at is wanting to get in at that earliest intervention before it escalates to maybe a more intensive need for support or a statutory need for support. So that having those initial conversations. So I'm fortunate, I'm really blessed. I have 3 of the most amazing community seniors who have these conversations day in, day out. And if I was to say to you, in a 3-month period, October to December, they had just short of 1,300 contacts in Burnley, just in Burnley. And the vast majority of those were signposting to, you can go to this organisation, this service can support you, or come into these groups. And it's about that early support and intervention. I hope that answers your question.
Yeah, brilliant, Sue. Really great. Thank you. Well, let's bring Chris in at this point. Chris, your area is sort of mental health and social prescribing. So just share with us the needs from your perspective. I guess you're dealing with people struggling with loneliness that social prescribing supports. What are the big needs that you're seeing?
So we're a service predominantly for adults. We do help families in that we support parents. I think Sue did a brilliant job at covering out pretty much all of the issues that are faced by the UK at the moment. Some of the other things that we see are caring responsibilities. That's a massive area for us. So lots of people looking after loved ones that need additional support. So the kind of things we would look at would be linking them in with the relevant services that are there to support them, making sure they're getting the right benefits and things like that. Social isolation, whether it's due to mental health issues, trauma, relationship issues, or just that as people get older, they lose some friends and family. Those are some of the needs. Access, so we're working with the local mosque to try and help them get more access for their congregation to the different services that the GPs offer. And then asylum seekers and refugees, that's a big issue for us as well in Stockport as well.
Brilliant, thanks, Chris. And let's just think again about, if we've got someone in our community, say, that we've visited, that we know of, who's really struggling with isolation and mental health. How do we, get them to the support that you're offering? What's the route there?
Yeah, so probably it would help if I give a little bit of background about what a social prescriber is. So essentially, we were brought into being by a piece of work that the GPs and the NHS did on how they could better support patients. So previously, you had patients coming in for stress and low mood. GPs could help with the medication and clinical side of things. But if there were underlying practical issues like debt, they couldn't help with that. So they brought us in and we started signposting people in to the various organisations that could support them with that. We helped them develop their skill sets as well, and then some self-care tools as well. So as it stands at the moment, most referrals come in, about 80%, I would say, coming from GPs or nurses, simply because they're aware of us, and not many people are that aware. But we have a switchboard number, a link, and people can just ring up their GP and ask for a referral to a social prescriber. And that's probably the best way in. Once we get a formal referral, then we meet with people. We have an hour-long conversation with them to find out what's happening, help explore what their needs are, because a lot of people come in, they've got low mood and they don't really know what exactly they want. And then we slowly start linking them in with the right people, building up their confidence, and that sort of thing.
Yeah, that's really helpful, Chris. Thank you. Let's just go back to Sue, if we may, just to take us into, once you've got someone that's got a need. Often it's not just a single need, is it? Actually, they might present with a symptom, but there can be all sorts of upstream causes of that problem that people are facing. I guess, could you give us some kind of idea what successful referral looks like? How are people helped through the network of services that you connect with, Sue?
So successful referral, what does that look like? Obviously, it's important that everybody knows the services that are available out there. But I think the key to success is that individual recognising and acknowledging and engaging with that support. And that's where the success starts, because we can all sit here and have the most amazing services, but if people don't or are not able to kind of make that step. So that's the biggest and boldest and bravest step. So I think we need to acknowledge that. So I think essentially is about understanding who's out there. And as Chris was saying, it's identifying the multiple things that families might be facing and who's the best placed. So it is around that coordinated level of support. So success is around knowing what people's expertise is, the service they provide, how families can access that, how professionals can refer that family into that service and support, to do that hand-holding, which is really important, because it's we always say, I am part of a phenomenal team here, and I feel like I'm really bigging up Burnley, but they are a great team. But I think the most important person within our team is the person on the reception at front door, because it's you never know what situation people are coming from and how much confidence it's taken them to come into that through that front door to say, I need support, I'm fleeing this situation, this is what's happening to me. So for that person, whoever that first port of contact is, it's really important that they are, able to, meet the needs of that inquiry, to support that individual, to get, other people involved, to be able to signpost that level of support. I think what we consider ourselves as family hubs is we are the front door of children's services. But children's social cares don't necessarily have that front door approach where families can just kind of turn up to, but they do here, and it happens on a regular basis, you know, which is really good, that people feel empowered, and then we can make those connections, and that's that positive referral, and recognising where they are on that continuum of need, what level of support is needed, but doing it in a way that's supported, that it's not feeling quite overfacing for that family.
Yeah, thanks, Sue. And can you give us an example of perhaps, you know, a common success story, if there is such a thing, of where you're able to refer to, you know, someone onto a service where they do get the help and a good outcome? Is there anything that's common that you could share?
I think one of the most common things that we have is that people are struggling financially with the cost of living crisis, and it might be that there's been a breakdown in a relationship that means the finances into that household have changed, particularly affecting families that are new to country who are working on a minimal kind of budget that's allocated to them. So we have lots and lots of families that are that just turn up at the centre. So obviously we signpost to all of our warm and welcome sessions, which are family sessions. So they're supposed to be for children, young people and families. But if Ethel, age 90, turns up and needs a cup of tea and a cheese toaster, then that's absolutely fine also. It's then the referral onto the food banks and to that wider community. So food finance is a real key issue, but that's what families tend to present with. And then it's the unpicking of other things. So we have lots and lots of families that, you know, attend. Another one is the domestic abuse. So people who are fleeing abusive situations, who will quite often just turn up with, you know, and it's more often than not, it is mum with the children and, you know, with whatever they've grabbed. So that's quite an emotional time for everybody involved in the families, you know, obviously, but the staff that are supporting the families, to be able to make sure that they go to a place of safety and to equip them with everything that we can possibly equip them with as they go to a refuge, because they go with nothing basically, and that's really hard.
Yeah, wow. Yeah, I mean, it's wonderful what you do. You're addressing such crisis needs and such vital needs of you know, our community, people in our community. So it's inspiring to hear what you're able to do. And I guess just going back to that map that we showed earlier of all the churches and what they're delivering, that's going to be helpful, isn't it? I know we're doing that in Burnley with you, Sue, which is amazing. But that we begin to see how useful and valuable that kind of tool is, really, to help you connect families to the wide range of different services that faith groups deliver. I'm going to give you people an opportunity to ask questions in a moment. So if you've got a question, do put it in the chat or raise a hand, and I'll come to you in a moment. But just to nip back to Chris now. Chris, just for your work, really, thinking about you know, what does success look like? You've got someone who's engaged with, you know, your service. How do you refer people on? What does success look like from your perspective?
I think in the time that I've worked in social prescribing, it's changed quite a lot. So you have the more obvious social stories. So there was a young man who came to me because he was suffering low mood, didn't have any motivation to get up and get out. His story was he'd got an apprenticeship for a Formula One company. Then he'd been very ill, had some major surgery, and he couldn't lift anything heavy anymore without passing out. So he'd lost a few years just mentally trying to recover from that. And when I met him, we had a look around, we looked at different options, and I asked him about radio control cars, and you can get some quite enormous ones. And he found a radio control, we found a radio control drift car club. And that was the spark that it took to start getting him up and about. And then he was willing to engage with other services. So in terms of the social side that stand out, that's probably the most obvious type of success story. But more and more at the moment, what we're finding is we're helping people with mental health. They might get a referral in, but that referral might either get lost, or they might get one call, and if they don't pick up the phone, which people with mental health issues tend not to do, that would just drop and they wouldn't chase it up anymore. So if people come to me, we do an awful lot of hand holding to make sure they stay engaged with services. There's a service called Survivors that's great for men who were victims of childhood abuse, but it's got a 2-year waiting time. So for someone that's been around that once or twice, I'm now holding on to people a bit longer, checking in with them every couple of months just to say, look, keep waiting, because it's almost damaging for the individual that they feel that they're not important to anyone because there's such long waiting times. So you kind of get both sides. You get the nice social success stories, but also the fact that I can get people in through the front door and getting them the support that they need with mental health and keep them on the books until that happens. That's an important part of what I do as well. Yeah,
fantastic. Just that staying with people, isn't it? And that's great to hear that's working. People are being shy. I've not got any hands up or any questions in the chat as far as I can see yet. So if you want to come in, do. Oh, there we go. Aaron, you've got a question. Do you want to raise a question?
Hi. I've got a question for Sue. Sue, I know we've exchanged emails in the chat, and I think it might be good to have an offline chat further because I've got quite a few more questions. But for the sake of a bit of discussion in the group, I'd love to hear your thoughts on the relationship that the family hubs in Burnley, in and around Burnley, have with, firstly, faith communities and the CYP provision they provide, and also the relationship that they have with children's centres. I do some family hubs work in Bristol City, and the relationship between the family hubs and the children's centres dotted around is not quite what I would have expected. To keep that simple. So just those two different relationships, I'd love to see your thoughts in a different part of the country.
Okay, so I'll answer the second question first. So in Burnley or across Lancashire, the family hubs are the children's centres. They are what we're currently identified as Sure Start Children's Centres. So we have family hubs and also family centres. So I'm based in the Burnley district, and there are 7 centres across the Burnley district. 3 of them are identified as family hubs, with the remaining 4 identified as family centres, but they were historically children's centres. So the relationship is brilliant because we are one. So it's the Lancashire. I think it was back in 2009 that all of the children's centres in Lancashire, across Lancashire, went under Lancashire County Council as a local authority. So there's been that natural progression, in that way. So so that's great. The link with faith organisations. So I think back in the summer last year, we linked with Mark and Peter, and we were instrumental in some mapping of what's happening across mosques and churches. I think we'd 14 mosques and 34 churches, something like that. And looking through working through kind of a spreadsheet of questions. The biggest one was around family support and food, and I think there's probably around 33 questions. And that was really insightful as to understand across each church and each mosque what they do. So do they do parent and toddler? Have they got any youth groups? Is there basically anything? It's quite an extensive questionnaire, and that is an ongoing mapping exercise. But what that allows us to understand is what they're doing, what we're doing, and how we can do that together, and how we can make sure that we join the dots and we can signpost effectively and efficiently families to the various support networks across. So I have to say, family hubs, there's lots of different kind of elements within family hubs, and the VCFSE sector is a massive one, and within that the faith sector is huge, but we are certainly on board with that. And we had a conference in October, which seems forever ago, doesn't it, Mark? But we had a conference in Burnley in October, and we had 100 people came to that conference. It was the first time we'd done it. It was great. We had a marketplace, which was really, really good to allow I think we had 22 different organisations from the Family Hubs partnership actually sharing their information. So, and then representations from mosques and churches came along, and we're able to engage directly with those organisations and learn a little bit more. So that was a really good starting point after we'd done the mapping exercise. We will not be finished. We will never be finished, because it will always be a moving, growing, evolving picture. So that's kind of the relationship and the connection. Something that I'm very passionate with. I'm heavily connected to my church. I don't live in Burnley, I live in Rossendale. So I'm very connected to my church. So, and I know what we do from our church, and how important it is to that wider community. So I hope that's answered your questions, Aaron.
Really helpful, thanks.
Yeah, brilliant, Sue. Helena, it's lovely just to welcome you. Helena, it works. Well, do you want to just tell us your role, Helena? Is social prescribing the right description for it?
No, that's not really my role.
Okay.
I'm not a social prescriber. I work for London Borough of Bromley within the local authority, and my role is Principal Loneliness Champion. So my role is implementing our Tackling Loneliness strategy. However, I work with many social prescribers on a platform which looks at promoting everything that goes on in our community, with a large volume of faith organisations promoting their low cost or free activity as a way to increase people's social connection of all ages, all stages of life, and people from all backgrounds that live in Bromley.
Yeah, brilliant. Thanks, Helena. Well, thank you so much for joining us. Good to have you
Thank you for having me.
for this part of the conversation. Peter, if I come back to you, because I think you were going to share a little bit more about what referrals looks like.
Thanks, Mark. Yeah. Sue just talked about joining the dots, and that's what it's all about. Bit of background. This is in Bath. We had a lot of children's centres and youth centres closed by the council over the last number of years because they didn't have the funding for them. And some of those buildings have moved over to be run by local churches and are now doing or trying to do the same sort of stuff, but under the churches. So it's a question of there not being enough professionals around, and therefore the professionals, the council people and social services, need volunteers in order to have enough people on the ground to do all of this. In terms of referral mechanisms, we've gone through 4 stages, or we are going through 4 stages. The first one, which is still very alive, is that in COVID we started a central phone line called the Community Wellbeing Hub, and that's run by a division of the council, and so anybody can telephone in and can then they don't meet anybody, they just refer them out to one of about 30 agencies who are on their list, so that people can help to get them. That doesn't help them to actually get from A to B, it just tells them that's a place that you could go or take somebody to go there. Then secondly, we developed the Live Well website, which is a site with hundreds and hundreds of different places and things that are happening to support people in our communities. The problem is there's so much on there that unless you're an expert, it's hard to find out what's there. The third one, we're just in the process of developing, and we're going to launch a trial soon, which is using artificial intelligence for a program called SADIE, S-A-D-I-E. And with that, you'll be able to talk to your laptop or your iPad, and it will then give you answers. It'll search all of the Live Well website and any of the websites of any of those organisers. So it's like Google search, but much more up to date. And it's being made so that it's friendly for volunteers to use. Because the challenge is that in lots of certainly in our church-based places, volunteers are not good at doing referrals. It just is too difficult. So we're trying to make SADIE so that it's fun to do, and that the individual and the person they're helping can work together with it. And so that's something that's growing at the moment. And then lastly, the fourth one, we didn't get any funding from the government for the family hubs networks in our area, but we have started a welcome community network, which is trying to do the same thing. And it started off by being for families, but actually the mechanics, the mechanisms within it, and SADIE is part of that, are such that it benefits any sort of social service activity done by the council, done by the churches, done by charities. So that network, the Welcome Community Network, has really got three purposes. First of all, just to realise that we're all in this together, so as we've talked about, so togetherness. Secondly, to help with referrals and signposting. And thirdly, to provide information and stories so as to encourage everybody. So that's all typical network stuff. And it's just beginning at the moment, so can't tell you how it's going. But that's an update of where we are on our journey.
Thanks, Peter. Brilliant. And, you know, that's a real demonstration of collaboration, isn't it, with civic and health authorities that you've got going there. Something at Gather Movement that we really encourage church leaders and church unity groups to do is to engage with at least 3 key relationships. And we've got 2 of those people on the call today. We've got Sue from Family Hubs, and we've got Chris from Social Prescribing. Helena, we definitely include you as part of that. I know you've said you're not social prescribing, but it's connected, isn't it? And so yeah, it's great to have you on the call today, so we can you know, just understand a bit about your roles and what you do, and the fact that it is possible for faith groups to connect. The third role is what we call the VCFSE services. VCFSE stands for Voluntary Community Faith and Social Enterprise. And there will be someone at the council who heads up that service, which provides all sorts of advice and connecting for that sector, that group of organizations and charities and faith groups. Yeah, I think it is about discovering that, as particularly as a network of churches, when we can go and say there's lots of us actually, and you know, we're across so many postcodes in the area. It's really exciting to get round the table and explore how we can work together, because these are such vital issues, aren't they, in our communities? And actually, if we're really going to care and try our best to offer good help, which Peter mentioned, then actually we've got to work with the gifts in our community, and that is in the civic and in the health areas. So that's been really good. Any other thoughts or questions that people want to share before I go on to ask Julian to share a little bit? Whilst you're thinking, I'm going to just share this wonderful resource that Julian has put together in Birmingham called the Christian Faith Settings Toolkit. And this is, Julian, over to you. Do you want to just share very quickly, if you can, what this is all about and what it's achieved in Birmingham?
Yeah, absolutely. So it's good to be with you this afternoon. Faith leaders are really, obviously a really vital part of our communities, and they have great leverage. I think during COVID, sort of government agencies discovered how important faith leaders are in making things happen in communities, and I think that's certainly the case with health and social prescribing. Birmingham is an incredibly complex city of many different faiths. So we've developed in Birmingham a series of toolkits for the main faiths. I've been involved in the development of the Christian Faith Toolkit. Birmingham being Birmingham, there's a myriad of different types of Christians, of different Christian traditions here. So in developing this tool, we've worked with a whole range of different Christians to see what their issues are, and particularly engaging with health provision, because that's a real issue that some of our communities face. It's how to get appointments, how to understand what needs to happen, should happen with particular health concerns. So access has been a really key issue that we're working hard to try and you know, provide support and overcome some of the barriers people have to accessing healthcare. So we work with different groups, and particularly I was particularly keen in developing this tool to work with groups who are traditionally underrepresented. So some of our newly arrived Christian groups, for example, are Eritrean, Ethiopian, Tigrayan Christian groups are very underrepresented in the public square in conversations like this. So I was very keen to get them involved in this conversation. So what we have is a toolkit that's quite comprehensive. So it looks at health issues that are faced by particular communities and provides an overview of those health conditions and where faith leaders might signpost to. I'm going to say something now. Yep, there we are. Thanks, Mark. You can see it's a very comprehensive list. I'm going to say something now that people invariably disagree with, but I'm going to say it anyway. And please come back to me because I think it's a really useful conversation. I think faith leaders are woefully have woeful knowledge base around health issues and where to refer them. Some of these things are very complex. So one of the things I have a particular heart for is substance misuse, which is an incredibly complex area. And kind of what I found in engaging with faith leaders is that, you know, a lot of people really don't know what addiction is, what causes it, and who on earth do you refer people to? What should you do for people? What shouldn't you do? So I think we're really keen to skill up our faith leaders in both understanding what people are presenting with, but also the signposting, so that we're absolutely the best that we can be in terms of caring for people. And I guess one of the elements of the toolkit is as well is it's not just about educating faith leaders and Christian communities. It's also about thinking about opportunities for teaching, learning, and preaching on health related subjects. So I think it's a very incarnational model. It's about thinking about the well-being of the whole person, and you know, going back to my sort of interest in addiction, there are spiritual aspects to addiction and to recovery. You look at the 12-step program. The 12-step program is a spiritual program in essence. That's where it came from. So what we're looking at here is helping people to develop a really holistic incarnational model. And at the end of the toolkit, there are some checklists for Christian communities to sort of, you know, really think through how they're engaging with health of their own worshipping community and the health of the wider community. So I think it's you know, it's a tool that can be, we're very happy to share it with other people around the country who are interested in using it. Very happy to do that. In Birmingham, as you're aware, we faced a lot of challenges and economic, Birmingham City Council, governance. There are a lot of things going on at the moment. And so in terms of there was going to be a sort of launch of the toolkit, so citywide launch of the toolkits rather, not just the Christian toolkit. That sort of wavered. So my plan is to, which everybody's happy with, I think, is to launch this with our church, because I'm Church of England minister, to launch it within the Church of England Birmingham and with some of our ecumenical partners, and really for the churches to pick this up and run with it. The public health team, funding, and also a number of other priorities. You know, launching this will happen. You know, there will be some sort of launch from them, but in the meantime, I think it's up to the churches to grasp this and move with it. So there we are, Mark. Very brief overview.
Well done.
Answer questions.
Yeah, great. Julian, I don't know whether you're happy for us to share that resource, because I'm sure there'll be a lot of interest in seeing what you did.
Yeah, please do. Please do.
Either with your, I don't know whether you could put the link in or your email so people could access it. That would be super.
Yeah, happy to.
I think I mean, this is an amazing resource, isn't it, to think about upskilling. We need to equip the church to, help people find the support that they need and to knock on the right doors. If you've been involved with church ministry very long, you'll know that one of the great troubles is people trying to access and get the support that they need. Sue, and Chris, if I perhaps come back to you and Helena, one of the challenges, of course, of public services is that they are offering just an episode of care. And actually, for people, for the sort of whole of their well-being, they need support probably week in, week out. So I think we are excited that faith groups have a role to play in being there week in, week out with people, because they're running these groups week in, week out. But just your thoughts really on the challenges. Do you see that a lot of public services just offer, a few services? They might be vital in terms of getting people out of debt or whatever it is, but actually there is a need for more hand-holding week in, week out. Sue, any thoughts?
Yeah, definitely. I think from our side of it, we have the family intensive support workers, and they will be involved within a family for 4 to 6 months or maybe longer. But I think ultimately, whatever kind of threshold of support needs the families at, the exit strategy is always really important, and it's that continuation, and it's about that ability to be able to empower the families to be able to connect to those organisations. So I think ultimately, if we were looking at families on an intensive level of support, it's connecting them to wider, so to befriending networks, to establish groups that are already going out there. So it's part of a coordinated pathway of support, and everybody undertaking their individual role. So it really is that team around the family. So once that intensive level of support has come to an end, and the needs have been met, which is fantastic, it's the family have got that continued support with a befriender that might come from Home Start, or accessing the socials at the church, or maybe going to a parent and toddler session in the community. So it's about that continuation, and everybody's got a part to play, haven't they?
Yeah, brilliant. Thank you, Sue. That's encouraging. Chris, we just saw that amazing resource that Julian has put together in Birmingham. Do you see the potential and the need to multiply people doing your kind of work to help them find the right social prescription for themselves?
A couple of comments on that. First of all, I think that social prescribers are in most GP practices around the UK now. So I think we are pretty truly embedded now. So I think that service is there. But time and time again, when people come to see me or I go to an event, people don't know about social prescribers. So I think it's more of a case of getting the word out there, because if people are referred into us, maybe by the church leaders, we can then handhold and help that person get the support that they need and help them navigate the health services as you described. If that's lacking amongst the church leaders, then we can do that for them. In terms of duplicating the work that's been done in Birmingham, I believe the Chelwood Food Bank, they're starting to build a database, and we're in the process of putting a lot of our contacts and stuff like that into that database, and it would work in a similar way. People would go on and search for what they needed. But I think there is a need definitely for some support as people try to make change. Sometimes I have people come in one appointment, you tell them which services they might need, and they never need to see you again. I would say most people, 3 to 4 appointments is about right. What we're trying not to do is de-skill people though, and create a dependency. So usually around 6 appointments, if we haven't managed to place them somewhere, what we will be doing is encouraging them to give it a go and then come back to us if they have any issues. But generally what we do is at the beginning, we try and explore the issues and link them in so they get the practical help. And then we try and help people work on their self-care and develop their own practices so they can look after their well-being day to day.
Yeah, thanks. Helena, can I ask you, do you want to share any thoughts on that, about this episode care versus the need to, walk with people week in, week out?
I think there's multiple layers to this, and in terms of what Susan was saying, we have support for those who need real dedicated care within a local authority setting, within our health setting, through social workers and whatnot. But actually, there's a real point where our faith groups are fantastic in that care or support that's actually really low level, which means it prevents people from getting to that really big point where they need huge amounts of intervention. And obviously with those programs, there's a huge amount of funding. So keeping people to ticking over and actually being really preventative is something which our faith groups are experts at actually getting there before there is a big problem. And that's when you'll find lots of different agencies and organisations all working together. And it can be really timely, where actually if we had these things beforehand and people knew where to go beforehand, we might actually stop some of that kind of firefighting in different places. I'm really fortunate that I am one of 2 people in the country which have a full-time role that comes to tackling loneliness within a local authority setting. That is my day job 5 days a week. And so I am very fortunate sitting in where I do. I am connected to all people. So our voluntary sector, our faith network, our services which we deploy for our local authority, the hundreds of partners, as well as our community leaders and those who want to help support the next everyday person because they're really passionate about people within a particular area. And I think if there was more of one person in every local authority who had that kind of connecting role, wow, what a difference we'd see by actually joining all those dots together. So I speak a lot to our social prescribers and say, I've just got this email about this brand new event. Do you know about it? And they go, no, I had no idea. I'll connect you with the organisation. And actually, I'm a real relationship builder. For instance, we have outside of our borough a beautiful museum called the Horniman Museum. And they provide various different bits of social prescribed programmes over an 8-week period. They're out of borough, so probably wouldn't have looked at them before. Out of the 8 spaces, 3 people came from Bromley and actually travelled the whole way across our borough. Within Bromley, we are London's largest geographic borough, and they travelled the whole way to get there. And that really shows you that was the perfect thing for them.
Yeah.
And sometimes you just know about it. So actually being connected with people is really important. And I must say, Julian, your guide that I've just looked at online is extensive and it's fantastic. And wow, that would be a real dream for us to have something like that in Bromley, because we have a fantastic multi-faith sector within the borough. And hopefully with working with yourself, Mark, we can showcase that even better around what we're doing and how that can help everybody.
Great, Helena. Thank you. That's so helpful. Peter, perhaps go to you for any final comments before we close.
I think what we've heard again and again is this is about people in our churches building relationships that are really important. Lots of people find it hard to engage with officialdom in any way. And sometimes, almost bizarrely, the more in need they are, we find that the more reluctant they may be to engage. And they need those places where they can build relationships. And I think that's where we are, that's the biggest thing that the churches are doing already for many different groups of people. What we all need to do then is to see how we can help those people to get to the other places that they need. And we've been looking at a number of different ways of doing that. And it's really great to hear from all of us just how many different ways there are of doing it. And I think we've all learned that everywhere is different. There's no standard answer for every area. It all depends on who we're working with, who we know in the council, who we know in other charities. So none of what we've been talking about is a blueprint. It's all just examples for us to try and follow those basic principles.
Brilliant. Thanks, Peter. And maybe some of the, things that we can take away is that this idea of mapping what the churches do, so we can see that as a good thing. If anybody wants to explore that, then do get in touch with me at Gather Movement and we can help you find out about that. We have talked about some of the key relationships, and it's been brilliant to have those roles here today with Sue and Chris and Helena. I think also in some areas we're trying to find an enabler to try and just coordinate some of this equipping, really, as we try and work together with our civic and health organisations and the good people in them. So there's a few takeaways to perhaps encourage you to think about. Thank you again to Sue and to Chris and to Helena and to the rest of you for joining and being part of this.